One of the most common questions I get asked as a dentist is, what would you do if it was your teeth? And when it comes to taking care of any of my patients, I always try to make sure I put myself in their position to see what I would do. And in the majority of the cases, I always like to save my own teeth. So when I treat patients, I try to do whatever I can to save the tooth, but I also give them the pluses and minuses of doing it. If money wasn't a thing, then sometimes we can do a lot of stuff in dentistry to preserve a tooth than actually extract it and put an implant in. So if a tooth is hopeless, our choices are limited. But sometimes in dentistry, we're faced with choices where we can save a tooth, but it would require a lot of procedures like, for example, crown lengthening, um, adding a root canal, doing a metal post, putting a crown on it. And, these are all factors to think about. And it's important to understand both sides. If you want something predictable that's going to work and it's going to be like you don't have to think about it anymore, there's always a route. But it's just every patient's different, and understanding what is important to them helps me determine what's the best route to go for each patient. So not every patient's treated the same.